Hello, my beautiful people. You're welcome to another episode of Nursing with Abby. Wow, it's so exciting to be here today. And you can see I'm all dressed in pink. You are still in October, our pink month, which is our breast cancer awareness month. So I hope you are putting on the pink, and I hope you are getting yourself well aware of breast cancer and how to do yourself breast examination. And I have a video where I explained how to ensure that you accurately check your breast for any lumps, any dimpling, any bleeding, and any deformity or change in size. So I've dropped the link in the description box so you can get yourself more educated about how to take care of your breast and what to do immediately you notice any changes. All right, before we go to the business for the day, I'd like to thank all of my subscribers for always coming back. Thank you so much for your presence. I really appreciate it. Thank you so much. So if you are a new subscriber or this is the first time of coming, seeing my face, let me give my brief introduction. My name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. Now, on this channel, I talk about nursing, I talk about lifestyle, and I talk about everything in between. So today, I'm going to be talking about a program organized by a wonderful woman called Mrs. Denise Ejoh about raising more awareness on cancer generally, both breast cancer, prostate cancer, brain cancer, skin cancer. So she actually owns a foundation called CORMODE Foundation, and it's awesome. But I'd like to take you through my journey of the knowledge of breast cancer and all that. It's actually a very pathetic journey, a very pathetic story, but I know you're going to learn a thing or two about it. Now, it actually happened about 15 years ago while I was a nursing student. Now, it took me, I think I was in part 2. Yes, part 2 as a nursing student. So I had a beautiful, wonderful childhood friend. We grew up together in the same street. So our mother, she was very accommodating, very loving, very peaceable and lovable. And she unfortunately was diagnosed of right breast cancer. She actually had a lump which was removed, and it was noticed to have cancer cells in it. So she was advised to go for right mastectomy, which she did. In fact, she recovered, she got back to her life, she started using a prosthetic breast, and she was even living her life as if nothing happened. She was quite optimistic about life. Sincerely, I really, really admired her courage even at that point. But unfortunately, at that time, we didn't have much of the technological and medical advances we've had on oncology as we have right now. So about a few months down the line, she was diagnosed of having a breast cancer shifting to the other part of her breast and surrounding tissues. So another mastectomy was advised, and she blatantly refused. She said no. She was just gonna enjoy the bit of her life, and then she would live in peace. So she actually threw in the towel 2 months after, even with a smile on her face. And she fought it gallantly, but unfortunately, the cold hand of death took her. Since then, I've been trying to, really understand what this breast cancer means and all that. So, but about 15 years down the line, cancer treatment has increased tremendously. We've had so many survival cases. We have so many people surviving it with a lot of instruction, with a lot of knowledge, with a lot of medical advancement. So, I also know of someone who had a brain cancer, and it was immediately spotted, and a surgery was done on her with a lot of chemotherapy, and she's doing really well. And she's the convener of a foundation called CORMODE Foundation. And it's awesome because it's a beautiful foundation, because I think I got the spelling wrong. I said CORMODE Foundation. I'll check and I'll put it on the screen. So she is a strong woman. She's actually an educator by excellence. So, and she's passionate about spreading the awareness and knowledge about this cancer. And she has a particular program slated online. It's actually via Zoom. And she's going to be sharing her experiences and teaching us what to do better. Yes, and she's an awesome woman. She's an awesome woman. So I'm going to put the flyer right here as you're seeing it. I'm going to put it in the description box also. So I would love us to join. It could be something not for you, it could be for somebody close to you, it could be for your friend, it could be for your neighbor, it could be for your client, it could be for somebody just to save a person's life. So please try and make sure that you join the program. I really didn't have a good experience with my first encounter with a cancer patient, but we've had so many cases of cancer survivors, even as young, old, middle-aged. We have so many of them who are growing and living well with out the cancer. Some are still going for therapy, but they are still optimistic about life. A lot of people are already on remission, and that means remission means that the cancer cells have been cocooned. The cancer cells have not really been negative on their body systems, and quite a number of management has to be done: radiotherapy, chemotherapy, and it's quite a lot. But for quite a number of people, they've survived, and they're doing really well. So Mrs. Denise Ejoh is a wonderful woman, and she's the convener of this. Dr. Denise Ejoh, she's the convener of this program, and she is a wonderful woman. So I'd love you to join the Zoom link on the 30th of October at 12 noon. That's West African time. And she's always talking about her experience, and she'll be encouraging and advising us to be better. Yes, to be better in case anybody has any issues living with cancer, living with anyone, or having anyone living with cancer that please invite them for this program. If you're a nurse and you think, okay, I'm only involved in midwifery, you could have a client or somebody who might need this information. As they say, knowledge is power. Knowledge is light. Knowledge is strength. There are some information that with early detection, it could help to save a life or save lives. She's also on Instagram page. She's very active on social media. She's very active on her emails also. So CORMODE Cancer Foundation is actually the Instagram link, and she is very approachable. She loves to help, and she loves also to make people's life better. So please, like I said, I'm going to drop the link, the Zoom link in the description box, but you can see the poster right here as on the screen. So I also love to join. I also want to be a part of this program because I also love to learn a thing or two. So make sure that you join us, and we'll be expecting you. Thank you so much, everyone, for a beautiful time. This episode, it's still our pink month, so make sure that you put on your pink as a lady, put on your pink as a girl, and spread the awareness that early detection saves lives, and ensure that as soon as you hit the 40th flight of stairs, that's 40 years, make sure you go for your mammography regularly. Yes, mammography regularly is just a kind of procedure that is being done to check your breast cells to notify yourself if there's any cancer cells in there. Okay, it's very important. But also for whoever who has a lineage or a group of people from your family, or maybe it could be your auntie, it could be your mom, it could be your stepmom or your grandmom, that had or died from cancer or is living with cancer, please, you are also at high risk. So it is important also that you do a regular checkup on yourself, because as they say, health is wealth. So this is where I draw the curtain on today's episode of Nursing with Abby. Please ensure you like, share, and subscribe to your friends. Thank you so much, and have a beautiful day. Signing out from me, it's bye for now.